So let's talk about the facial bones. Again, these are the ones that protect the entrances to your face. So you have your vomer, your conchae, and there's actually 3 pairs of conchae. And actually, in rare cases, there is a 4th pair, but don't worry about that for this class. So there are the inferior, superior, and middle conchae. Hey, inferior and superior, those are opposites, right? And conveniently, middle is in the middle. And then the thing is that, why do I have this asterisk? Well, technically, the superior and middle conchae, they're actually extensions of that ethmoid bone, so they're not considered a bone by themselves. Then you have your nasal, maxilla, mandible, palatine, zygomatic, and lacrimal. So these make up your facial bones. Now, what's the vomer? So what we have here is the vomer, and the way I like to think about it is that it looks like a very skinny V. So the vomer is in the middle right here. So it kind of helps to separate the left and right nasal cavity as well. So this is the so vomer has a vertical plate. It's shaped like a squished V, and it's very much in the middle. So this is the way I think of the vomer. And you can see that vomer, and again, separating the left and right nasal cavity right here. Then you have the ethmoid. So remember I said that the superior nasal concha and the middle nasal concha are actually parts of the ethmoid. And so these are collectively the superior, middle, and inferior. They're all called together the nasal conchae. So the thing is that it's like a conch shell. What's the shape of a conch shell? It's kind of that spiral shape. Same with the nasal conchae. Their bony part, just like a conch shell, is kind of like calcified and very bone-like. Conchae are also very round and swirly, so that's what part of the reason or part of their structure as well. But again, remember I said the superior and middle are part of the ethmoid, but the inferior nasal concha is considered its own different structure. So it's not actually an extension of any other bone. So the inferior nasal conchae, so there's a left and right, these are not part of the ethmoid. They're kind of their own bone by themselves. And if you have the slides open, I know this might be a very shocking picture. I'm only showing a little bit of it because I'm not sure if it's too gnarly to show on Twitch. But I'm showing you the nasal cavity and all the conchae as well. This is actually a picture in the Martini book, I think actually we don't get to this till next semester, but I think it really does a good job of showing the nasal conchae and the sinuses. So you have your ethmoid bone, and it's forming here's that perpendicular plate. And there's the vomer. So this actually makes the bony part of the nasal septum that divides the left and right nasal cavity. Then this is what we call nasal septum. So when you have a septum of any type, septum is some sort of dividing barrier. And here we have the dividing it into left and right. Now the superior nasal concha, it's actually, again, an extension of the ethmoid bone. And then you have your middle nasal concha, and it's also an extension of the ethmoid. Again, the ethmoid having that very lacy and elaborate sort of structure. But what do you notice about the inferior nasal concha on the bottom? So notice that the inferior nasal concha doesn't extend off the ethmoid. It actually comes off from the side. So this is why it's considered structurally its own bone. It's not quite a part of any of the other bones that make up the nasal cavity or your facial bones. And then you have your meatus. Hey, meatus, remember meatus in the hallway. It's a passageway. So the passageways between these nasal conchae, they are called meatuses. Okay, so then this is the overall structure, but why do they have that elaborate structure? Well, the thing is that when you breathe in air, especially if you're in a cold environment, do you want to breathe in just pure, unfiltered, cold, dry air? It's going to be pretty painful to your respiratory system overall. So when you breathe in something through your nose, what happens is that these nasal conchae, instead of the air going directly into your respiratory system and your trachea and your lungs, what happens is they kind of delay it. And the thing is that it's not just dry like this. You have all this mucus, you all have all this moisture as well. So as you breathe in air through your nose, it starts to humidify and warm the air, especially if you're in a cold environment. But with all the mucus in there, that helps to trap any dust, air, or actually you have mucus and hairs. So this also helps to kind of like trap any sort of particulates, any pathogens, bacteria, dust particles that happen to enter your nose. So ideally, you don't want that going all the way deep into your lungs. So this is another purpose of the nasal conchae. And then the nasal bone. Hey, nasal bone right here. So it's actually pretty easy, right? And actually, like feel the bridge of your nose, right? So it's pretty bony, but feel this part, your front of your nose. Notice that it has some structure, but it's much softer. You can move it around. So you actually have like tissue, or you have integument there, of course, but you also have cartilage there as well. So this is why this part, the bridge of your nose, is very bony. But if you feel the rest of your nose, and this is another reason why when we die, well, cartilage disappears and disintegrates way before bone mineral does. So this is why when you have someone who's passed away and they decompose, this is why you're left with that hole there, because again, the rest of the nose decomposes, but the nasal bone is left. And then you have your mandible, aka, or layman's term, jawbone. So this is your lower jaw, and then that's pretty straightforward. And then you have the lacrimal bone. So this is actually a pretty good, useful root word is lacrimal, or anything that starts with LACR, sometimes O or LACRI. That refers to tears. So what we have here is this lacrimal sulcus. Again, the sulcus is some sort of passage or makes room for something. And then you have the nasolacrimal canal. Again, a canal connects two places. So the cool thing about the lacrimal bone, lacrimal refers to tears. So that's a cool root word. And then when you cry, well, what happens? Why does your nose start getting runny when you have a lot of crying? Well, as you cry, you're putting all this fluid in your eyes, and this is what's cool, that is that it actually drains from your eyes through this nasolacrimal canal and then ends up in your nasal so that actually ends up in your nasal cavity. So that's why when you're ugly crying, that's how you can tell when someone's fake crying versus real crying. If their nose is like running and whatnot, they're actually producing real tears, and all those tears are flooding into their nose, and that's why they have to blow their nose, and they have all that fluid going there. So why? Well, you have that nasolacrimal canal connecting your eyes to your nasal cavity. And then you have the maxilla. So the mandible is the lower jaw, but the maxilla, that's your upper lip, and actually some of your face as well. So the maxilla is pretty complex, but again, or if you've known some dentists, they sometimes call themselves maxillofacial surgery, so they're talking about that part. So maxilla, that's your upper lip, that's your upper part, but also part of the surrounding, well, actually part of the, what we call the orbital complex, and part of your cheekbones as well. And speaking of cheekbones, this is, so this blue one, and some of you mentioned that in the previous question, this is what you call the zygomatic, and it's so cool, the spelling. So there was a mnemonic, like, what? Look at your face and go into mirror and look at your face when you say the letter Z. So when you see Z, sometimes you kind of smile. So think of that. When you say Z, you kind of show your cheekbones. You're kind of smiling, right? So zygomatic, this is what you typically associate with your cheekbones. So yeah, Daniel Day Kim, very prominent cheekbones. So this is the zygomatic. Your cheekbone structure is based on most in part due to the zygomatic bone. And then you have something called the palatine bone. So palatine bone is this yellow one in this figure from Martini right here. So this is actually the anterior of your skull, and this is more toward the inner part and toward the posterior. So your palatine, so you can put your tongue on the roof of your mouth, right? So you can feel that bony palate. Like, it's very bony, it's very hard. So common misconception when you're first starting out with anatomy is that the palatine bone, your hard palate, is entirely the palatine bone. But as you can see from this figure, it's not actually mostly your palatine bone. Palatine bone does make up part of the posterior of your bony palate, but in typical anatomy, you see that the maxilla makes up the most. So why did they call it the palatine bone? I guess because maxilla was already taken, and it's still part of the palatine bones, or still part of the bony palate. So it's kind of the leftover. Like, we already have the maxilla, we're left with the rest of the palate, hard palate. Let's just call that bone the palatine bone. I don't know if that's the actual origin, but yeah, just what I'm getting at, the palatine bone does not make up the majority of your bony palate. And what's another way to know all the facial bones? Well, one is this is actually a useful way to study. Sometimes there's a lot of the slides and figures. What I used to do is although there was a student during the summer, she actually used like a PDF maker or whatnot to create labels and hide the names of things, and then she would kind of like reveal it somehow. I used to do it like the old school way. I used to get like Post-it notes, put it over the labels and names of things in the book, and then I would just like peek under the post-it note if I wasn't sure. I would test my knowledge that way. Okay, so mnemonic time. This is Vicky, and she's very special. Why? Because Vicky cannot make my pupils zap lasers, and I like this mnemonic because it tells you all the facial bones, at least the first letters of that.